Hey guys, Rohit Aldo Benjamin here to welcome you guys on our first episode on Teacher Topic series. And for this month, we have chosen palliative care, and it is taken up by our medical ethics and human rights pillar. So, yeah, let's start off with the introduction, which I'm going to be doing, followed by two other people who's going to do the background and the conclusion. So, yes, what is palliative care? I'm going to read out the definition given by World Health Organization, and it goes like this. Palliative care is an approach that improves the quality of life of patients and their families facing the problem associated with serious or life-threatening illnesses through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, whether it's physical, psychological, or spiritual. I know it's a lot of words, and yes, it's a big definition. That's why I've broken it down into smaller points. The first point being, it affirms life and regards dying as a normal process. It intends neither to hasten nor to postpone death, and very important point over here. And it also accounts the psychological and spiritual aspects of care. It helps us it helps the patient live as actively as possible until death, and it uses a team approach. So, yes, palliative care is a specialty in which there can be doctors, nurses, nutritionists, and even much more, just to make the patient's life simpler and to give the best quality of life to the patient and the family members. So, yes, that's a small introduction about palliative care. Thank you, and moving on to Deborah now.
Ethics in palliative care, the four core principles of medical ethics have to be followed. Respect for autonomy is the ability of the patient to take decisions based on full deliberation, and the doctor has to provide full consent, truth telling about prognosis and treatment options and side effects of those treatment. So for beneficence, the treatment is directed to be of benefit to the patient, balancing the risk and the benefits involved, and the all treatment provided should be of full benefit to the patient. And in a case whereby further treatment in the stage of the illness wouldn't be of benefit, it is a sound clinical decision to withdraw forms of treatment, properly informing the patient, the family, and the care team. For non-maleficence, it is a principle of refraining from unnecessary harm to the patient. In a case whereby further treatment will be fatal to the patient, it is necessary to withdraw that form of treatment. And for justice, we talk about distributive justice, whereby all allocations should be available to the patient. Rights-based justice, it is similar to autonomy and also providing full access to healthcare services to the patient. For palliative care, it is a human rights issue because most countries do not have access to palliative care programs, and this disregards the patient's rights to health and good healthcare services. About 80% of the dying would actually benefit from palliative care to alleviate pain and suffering in their final days.
Okay, so right now I'm talking about the models of the palliative care. So first of all, we have like the hospice care, and the hospice care is like a special kind of care that focuses on the quality of life of people and their like caregivers who have a life limiting illness, and it can be provided like in the nursing home, it can be provided in the residential facility or like an inpatient unit. You also have the palliative care programs. These are like institutional based programs in the hospital or nursing home to like serve patients with like life threatening or also like life limiting illnesses, and it can occur in hospital settings and also skilled nursing facilities. We also have like the outpatient palliative care programs. It occurs like outside, like basically like occur in like ambulatory care settings to like provide patients with continuity, patients that have like life limiting illnesses. We also have like the community palliative care program. Like as the name entails, it like occurs in like communities and like as a consultative teams like collaborate with hospices or like home health agencies to like support patients like life limiting illnesses. So moving on to like the importance of the palliative care. Like palliative care is very important because like it gives patients an option. Like it also basically deals with like pain management and symptom management, especially to those who are like have like life limiting sicknesses.